Rob Grenfell is a public health physician who's had a very strong interest in public health generally, has been a strategic health advisor to Parks Victoria. I didn't know such a thing existed, so it's great to know that you are giving that advice. He's been National Director of the Clinical Issues Hart Foundation. He's a very long experience indeed in public health and general practice and in policy. And one of the things that fascinated me is, as well as all of his medical and public health work, he's also involved in a community art space called the Goat Gallery. That's perhaps relevant as well. So Rob, welcome.
Thanks so much, Carmen, and again, thanks so much for the opportunity to speak in here. I guess a health advisor in a parks area, and I think picking up on those remarks, when I was an advisor in the health department in Victoria and I was had the opportunity after the Healthy Parks, Healthy People Congress in Melbourne to be seconded into parks, I said, you beauty, because the talks that I sat through yesterday, looking at the passion that we all have for open spaces and other things, was the thing to say to me, I can now put my passion and my health all in the one space and put that all into the one job. Because for those of you who've spoken to me know that I actually a real lover of wilderness parks and getting lost because you can't get tracked by your mobile phones or email or anything. And it's just terrific to be nowhere, which is not where we are today. Now, I'm going to draw on a lot of themes that have been running over the last couple of days. I sadly missed the first day of the Congress, but people have given me an update on some of the themes that came through, and yesterday as well, as to why is a health advisor sitting in a parks agency, and why did we actually get an award last night for a program that you're just about to understand bits and pieces of it. So if you move through here, I was briefed not to tell you about the research base of the benefits of exposure to nature because you've been told this before. The fact is that this research has been around for years, and it's a great travesty that we haven't enacted or we haven't actually implemented this research. Parks are actually good for you. Open space is actually good for your health. A proven fact. We don't need to do any more research on that. We actually need to get people into the open spaces. So I'm not going to waste any more time than just to say the general population may be able to access open spaces, but there's a significant slab that just can't do it. In the health promotion perspective, about 25% of people just don't have the capacity to do the sort of things that most of us with the wherewithal, with money, jobs, transport and other things can actually do. And these are those hard to reach populations which of course have the worst health burdens of all of us. So if you think about the effects, very briefly, from the individual, no-brainer. You go into an open space, it clears out your brain and it makes your legs move around. That's good for you. I don't need research to tell me any more about that, but we've got research that tells us that that's actually a fact. For the community, on a community level, we know that communities that have open spaces next to them are healthier than those that don't. We have large-scale population studies that prove that poor communities with no open space or open space that's amenable to them have an earlier death and higher illness rates. So you don't need any more on that. And as a population as a whole, from the wonderful words of climate change area, if we don't do something about the open spaces, we're all dead. And that's simply the value of open spaces in the larger scale of things. They clean our air, they clean our water, they decrease the heat in our cities. Again, proven facts. So what's the problem? 54% of adults don't exercise enough. We have the ABS are going to be running they're actually running now the next health and wellbeing indexes for Australia. So we will have new data over the next year or so. 60% of males, most males actually don't think they're overweight, but males are more overweight than women. Women complain about it more than men, but the men are winning in this one. And the cost bases of most of these are actually set on fairly early ones because unfortunately in Australia we don't run data regularly enough to give us these costs. So the $5.6 billion in healthcare is an underestimate because this is largely on 2004 data when we had the last analysis here. But we're looking at the prediction. The bottom one's the frightening one. 1/3 of 5 to 19-year-olds by 2025 will be overweight or obese. Horrifying. What does that going to mean to the health service? That's why a health practitioner is in a parks agency. We have to do something about this. We need to do something about this now. Just a little bit of Rob's economics 101. Departments of health get a lot of money. They get a lot more money than the environment sector do in large slabs of it, and they expend it in a considerable way. I tend to like to say they're not departments of health, they're actually departments of illness management. And I put on the bottom there, it's really actually should be more of a slither, because we'd like to spend about 10% of our dollar on prevention, that is wellness, stopping people getting illness, but we're not doing that. The sliver itself actually has been decreased again with the latest cuts that came through in the federal budget. But we have got a momentum from both states and federal government looking at prevention as a driver of trying to actually address the completely out of control healthcare costs we've got. So just to, and again, the reason why parks want a health person in their area, because they think that I've got money attached to me. I think I've tried on that, haven't I? The burden, cardiovascular. So working for the Hart Foundation again, I spent a lot of my time in Canberra talking about the costs of a disease that's largely preventable. It's inevitable in the sense that we all accept it being inevitable, and a large proportion of us, that is about 60% of us or so, are going to actually die of heart diseases, stroke or kidney failure. It is the commonest cause of death. We seem to forget that. We think cancer, cancer, cancer. You get cancer, you survive cancer, you die of a heart attack, okay? It's actually the commonest cause. Osteoporosis, for instance, which is also linked with physical inactivity, is an increasing disease because people are getting older, their bones are getting thinner. Their bones are getting thinner because they're not exercising enough, therefore they fall over, break bones and cost a lot of money. Renal disease, believe it or not, is related to inactivity, and I think independence for the elderly is also related to physical inactivity. So why we need to do it. Physical inactivity is a leading cause of illness and death. In fact, worldwide, it's the 4th cause of illness and death, physical inactivity. And that's the average child. 2025, he's going to be more common than not. If you look at some of the primary schools, that's normal nowadays. Parents bring their kids in to see you as a doctor and say, I think there's something wrong with my kid, they're too thin. And you say they're actually normal. All the other kids are too fat. And this is the problem. We had that very passionate talk last night about where they are. And I often say, we haven't got a name for the next generation. We've got Gen X, Gen Y. I'm actually calling them Generation XXL. So we need those kids to do this, the stuff that we all love, the stuff that I actually grew up doing, the stuff that I'm so damn passionate about. This sort of stuff, exploring, free play. It's great for your mind. It's great for everything else that actually fits into what it means to be a child. But this is actually our work. And that impassioned question last night from the park ranger saying, what about the computers? What about the family constraints? There's no time, no time, no time. I can't do anything. There's no time to do anything. And we keep building this and more of this. A great report that I read on the suburban sprawl around Melbourne. We are creating the next generation of poor people. In 20, 30 years' time, the outer suburbs of our major cities will be full of poor people. Why are they going to be poor? Because they're going to be at the mercy of oil. They're living in actually quite high density. The quarter-acre blocks have all shrunk. They don't have any open spaces to move around in. There's no actually space that actually generates them to walk, to do things that in fact actually would be good for their health. So if we want to create ghettos, we're doing a damn good job, and this is the richest country on earth at the moment, and we're actually making poverty here as you speak. So I'd love to be proven wrong in the future by making statements like that, but all the research is telling us this is the wrong thing to do. So again, parks, great place. Now we saw a number of signs. This is one of my most favourite signs of all. This is in the town of Oyen, which is famous for its vanilla slice, and also an obesity rate of around about 80% of the population. Quite a small town in the Mallee, but you know, you can't do anything in this town, so it's the most friendly town, as long as you like vanilla slices. If we think about the large-scale population pressures that we've got, and I'm only going to dwell on this because I'm going to talk more about what can you actually do. This is the dust storms that hit Melbourne. The dust storms hit Adelaide on a fairly regular basis. Our cities themselves are degrading, even though Melbourne's the most livable at the moment. We're starting to look at things such as heat effects, people dying from heat waves. These things are not foreign. Adelaide, obviously, and Perth and other cities, people are used to the heat a lot more. They don't tend to die as us weekies that live in some of the other cities and aren't used to it. You know, in the small rural town that I've been a general practice in Nattymark, people don't die of the heat there either because they know what to do. The only reason they are at risk of dying is they shut their house down so much they don't know a bushfire is rearing through the house or actually threatening the house and have to be actually alerted to it because they're used to bunkering down in the hot days. City people can't do that. It's always hot in the centre of Melbourne these days because the buildings are hot, the concrete's hot, and we need more air circulation through to bring it down. So let's move as to why people are not going to parks. You've got these wonderful assets. Why aren't they going there? Why aren't they doing things? And if we really look at it, there's a whole range of external influences that will either enable or impede getting people to work on their health in a park sector. Number one, you guys, the park sector is an enabler and a barrier. Probably most of the people in the audience here are enablers, but you can go back to your normal daily grind and you'll be able to identify quite easily where the blocks are and where the barriers are from stopping you from actually doing a lot of the good things that you've been trying to do. The health sector, and we'll step through that, and the barriers for people. The no-brainers. Where are the parks? I love to pick the park information sites a bit in Vic. I was driving from Ballarat to Bendigo. I wanted to go for a walk halfway through there in a park. I couldn't find one. I looked at your website. It couldn't help me. You know, these sort of stuff. And I know this stuff, and I can't find it. So these are the sort of challenges we've got. If you don't actually know this stuff, or you don't know you're actually looking for this stuff, how are you going to find it? How do I get there? What activities, what can I do when I get there, and what are the skills and the competence to do that? And we heard that last night about being frightened by bites, being frightened by all sorts of other things that can hurt you and harm you whilst you're away. So let's start with the health and community sector, for instance. The health and community sector needs assistance in encouraging parks. As a GP, I can sit there and say, you need to do more exercise. I reckon you need to do 30 minutes a day, 5 days a week, minimum. That's what you need to do. Patient says, yeah, that's a good idea, doc, walks out of the surgery. Are they going to do it? No. Is anything going to happen? Nothing is going to happen. I'm a busy GP, I've only got 10 minutes to spend with you, so I can't actually source out the Parks website or all these wonderful other things that you've actually put all this money and effort into to try to show the wares and the wonderful things that you've actually got. So I don't have the time to do that. That's one of the barrier number one. The health sector actually needs to know what options they've got. What can people do? What's relevant to these people? You know, if you've got people who are actually severely ill or chronic disease, what are the levels? What are the gradients? Looking at the options that you've got and also looking at motivation and interest. So in healthcare and chronic disease management, we tend to look a lot at the idea of what's their motivation for change. Most of you would be aware of this in, say, the QUIT model for stopping smoking. Am I ready to give up stopping smoking? Am I now willing to give up smoking? Am I trying to give up smoking? And this is really the same with physical activity. Most of you say, I'm gonna, and don't. The park sector, and this again is something that you need to take a long look at yourself as to what are we offering and who are we offering it for. Okay, I just received a huge big grant and I'm going to spend it on developing all this great network of trails and walkways, and nobody came. Those sort of things. Is it relevant? What are the settings? Is it accessible? Can people come to my park? And when they get there, what are they going to do? So if I break this into two parts, we've talked health and community sector, so that's where the people are that we want to do physical exercise. The park sector is this place where we would like to do that. And when I talk park sector, I talk open space right across from local government right through to national park space. That's the idea of what's available, what can do. You need the actual glue in the middle to do this, to actually join these things together. So facilitation itself, the health sector requires them to actually understand, yeah, physical exercise in open space is a good thing, I want this to happen. I need to actually be able to refer seamlessly, painlessly and easily into some type of open space physical activity sector. The participants need to know what are they going to do when they get there and how can they do that, and they need their confidence. They need to relearn what a park is and what an open space is, and we had Passion talked about that last night. So, people in Parks Foundation, with the very generous support of the Medibank Community Fund, put together what I'd call a landscape health promotion project, in the sense of putting all of our eggs into one basket, not just one egg in one basket. So we've all seen all those little projects where we say we've got a pot of money, 10, 20, 30,000, we're going to put that group of 20 people into this space. One worker's going to work on it. It all went really well. We evaluated it, was terrific. The money fell out, the person moved away, project stopped. I said, I don't want to do that because it doesn't work. I want to actually embed this into the organisational capacity of the organisations in an area so that they will say this is our core business and we'll continue to do this. So we're looking at a systematic replicable framework of putting this into organisational functions for getting people into parks. So what did we do in Geelong? Firstly, we identified the opportunities. We had to work with, it took 12 months to work with the organisations from the top down to the bottom, CEO buy-in and worker buy-in right at the bottom of the people who are actually taking those people into the parks. And we said, who would you put into a park if we could help you do that? And they put these groups and these groups, and we're going to go through some of those groups in a little more detail. Looking at their local health priorities, if the health service is not interested in open space activities, nothing's going to happen. Equally so, if the parks agency is fixated on maintenance, weeding, it's not going to happen. You actually have to look for those. And then you need to develop the relationships. And Medicare locals are one part to do that. G21 in the Geelong area is 5 local councils together with a very, very progressive type of local governance structure, which is why we chose to do our pilot in that setting. So what we have in that area is 4 referral options. So the community sector or the health sector are faced with somebody who needs to go into physical activity. The high intensity are for those people who are sick. These have just come out of hospital and they actually need high intensity input into actually their open space, and I'll talk about that one shortly. Coaching is for people who in fact actually need support. I can't do this without someone telling me, dragging me along or shepherding me or coaching me into this. Community group is that thing of volunteer capacity, but also sporting groups fit into that one nicely, is I've got other people doing this, I can do this, and we do this, we have the camaraderie of doing those sorts of things. General promotion is all that wonderful stuff you're doing now, your brochures, your websites and all those other things, because the population needs to have that information. Simplistically, for the picture people, and I'm one of those, this is a far better drawing than the one I originally drew when I was conceptualising this project. But, you know, we've got our unwell, obese person, gets a prescription from the health worker phones them up and says, look, there's an exercise program there and there. We've got our willing park guide, as we call it, not park ranger. We're talking, because this is a new job. This is a parks activities officer, is in fact actually showing them what a park's all about. You can do it with groups, okay? The group, you throw them in a bus and you take them to the park. That's all pretty simple. So, high intensity. These people are in rehab, recovering from serious illnesses. They do chair-based work. They do it in a room. It's pretty boring. They've got open spaces around them. Why don't we just drag them out, put them in a chair and do the same chair-based exercises outside in the park? This is happening weekly now. We did this with Bowen Health. It's not too hard, is it? It actually was. It took us the longest of all of the components to get this one going. This one here is the green referrals, and you know, yes, we're plagiarising New Zealand, but we do that with everything else in this country. We all know quite well, to my New Zealand friends, that all good things in Australia came from New Zealand. I didn't. The point here was GP writes a prescription. The prescription says you're going to go to this program, and this program is going to take you through a 9-week program of various exercise and activity. We worked with the local sports assembly to put the program together. They run the program. The GPs do the prescription. The Medicare local makes sure the referral happens and people are nursed through those types of programs. This is going to happen 3 times a year. We don't do it in winter because it's too cold. This one here is an absolute beauty. This is what I call the teary-eyed ranger moment. The ranger who was supervising this one always breaks down in tears. The Karenni and certainly around about a third of migrants to Australia are resettled in Geelong region. So we said, right, let's put them in a park. Pretty simple, throw them in a bus, throw them into the park. Okay, this one didn't take too long. This one took off like absolute gelignite. The issue here is, as the ranger said, you know, I can't believe the joy in these little kiddies' faces and their parents when they come here. The feedback from the families were, can we come here again? Yes, you can. It's free and it's safe. There are no landmines in our parks and you're not going to get abducted. These are the sort of the fears that migrants have. They don't know how wonderful this country is and all the beautiful things that we actually have here. This is the second teary-eye movement for the ranger. These people have got serious mental illness. They're recovering from schizophrenia. So the ranger said to me, I cannot believe how sick these people are. If you haven't worked with serious psychosis or recovery from psychosis, you just won't know how unstable and brittle these people are. But the statements such as, this makes me happy. Most of these people are fairly blunted in their remarks. One person saying, this is the best thing that anyone has ever done for me. You people are really nice for doing this to us. Again, put people in a bus and drag them to that point. Sounds simple? Nope. This was complex, and we're meshing it into the Mental Health Services Recovery Program. Now, this is a good one because that's our project manager for the Geelong region sitting there. We actually had to physically manhandle her out of this one. Again, low socioeconomic mums, single mothers, we know the poorest in our community, and certainly the children will be poor. Instead of having a mothers group in a building, let's do the mothers group in a park. Driven with enormous passion from the CEO of the Colac Council, Rob Small, who has actually now put aside an area in the local park for them to have a community garden to grow vegetables and other things. So they've got free play, organised play, interpretive play in open spaces. This is going viral in the Geelong area. That is, other councils are picking this up. How can we do this? Cost base, incredibly low. And Hart Foundation is an example of, again, community-based walking programs where volunteers take others for walks. Very low cost and very simple. And all you have to do is call the Hart Foundation in your local state or relevant state, and in fact even in New Zealand it'll work, and talk about community walking programs. Can we get these activated? Sorry, I've nested at 5. Actually, I think I'll make it too, Carmen. You won't have to manhandle me off. So we have a website which everybody has to have, and this website has a wealth of things, and anyone can link their community. So the council can put all their activities onto this site, and if you really want to know what's going on in your area, this is in fact actually what can do that. So we've pulled everything together to make it seamless to step through. So, transferable model. A healthy community and a healthy park system is our intent. We need people to visit and value the parks. One, we need behaviour change, and we need to mainstream open space related activities into what's happening. So those examples that I gave you of some of the things that we've done, because we've done a lot more than just those. Those are some of my favourites out of what we've enacted in the Geelong region. But to make it a no-brainer for the mental health worker, we're going to the park. We just do this. This is what we do. Or for the childcare, the maternal and child health, this is what we do. Our playgroup goes to the park once a week. And the rest of the time we're inside doing other things. Because one of the times, the librarians now from the Geelong Library are now taking out and reading books to these groups of kids in the park. Because everyone thinks this is great, because it is. It's really nice stuff to do. And they go, can I get involved? So they join in, and off it goes. We need a sustainable open space system. So the idea of planning, and we're now moving into a western suburb part of Melbourne. We're going to be moving into Brimbank to apply our model across there to see its transferability and how it would work in those areas, and looking at activation of space. And there's, again, we've gone through a sort of a checklist on making it possible for us to actually do this, because we're chasing success, not failure. But you need to have this included in planning as to where it is. Community resilience comes from having a healthy park system, and it also comes from running programs like this. Will develop resilience because it's people looking after people. It's doing nice things to other people. It's doing nice things with other people, which is in fact actually what most of us get out of bed to do most of the days of our life. Innovation, this is way out there, okay? This is one crazy, wacky idea that poor Jackie had to actually try to disseminate out of lots of scribbly scrawls that I threw on pieces of paper to say this is what this actually looks like. And Medibank want to do it over the whole of Australia, and we've said no, not yet. We want to actually throw this into some other areas and play with it. I want to actually finish with this, because you're going to go away thinking, yeah, I'll do that, I'll do that, I'll do that, because you are probably some of the most innovative and driven people in the park sector. That's why you're here. And I just want to temper that. This is extremely complex. Health has just moved into an area called systems research. For a country doc, public health physician, this is second nature to me. For people with engineering backgrounds, they're saying, gee, the health people are slow. But this is in fact actually health systems, which is state-of-the-art health promotion theories and certainly work and methodology. As the architect of this program, I can say to you today, I still do not understand what we've done in Geelong. completely to actually say here that this is in fact actually what's going on where it is. We have done a lot of things that had to be done. We had to look for local leadership, we had to look for money, we had to look for the partnerships, we had to develop and nurture those partnerships between agencies. We had to allow people to own this process to say, this group will go here. And then they come back and say, can we do it with this group? So yeah, sure, it's your program, it's not ours. So we weren't directing it from above, we were directing it from below, which is in fact actually, again, from all the theories of health promotion, no-brainer, the only way to actually get anything done in this space. The other part is leadership from various areas. The Medicare local CEO said to us, I love this product and I will push this product as hard and as fast as I possibly can across the Medicare locals of Australia. He said, hold on mate, no, we want to get yours right first. He said, I love this brand and I want to work with it, okay? He's becoming the operational manager of this program in Geelong, not People in Parks Foundation. Leadership from others, such as Rob Small, who I mentioned again, from COLAC, who's dragging the other councils along and the G21 pillar along as the CEO of a local government saying, we're doing this, full stop. And this is how we're doing it and we're going to work with others. So we don't have to lead this from above, they're leading it from below. And the persistence is to say, this is a damn good idea, this is something good to do. And I do like to use the steamroller approach sometimes because sometimes people you just do it. And now that we've just done it, a lot of the naysayers and others that are out there that were sort of reluctant to support a lame-assed idea are now wanting to join in. So we have a number of other partners, big partners, that are actually starting to say, we want to play in this space. So Vic Health has said to us, we want to play here. Beyond Blue has said, we want to play in this space. Yesterday I was speaking to the National Prevention Authority and they say we want to take this into other areas as well, we want to move this model around. So those of you in Queensland and New South Wales over the next 12-24 months you might be actually getting a sniff of this. And we've got a manager of the council spaces in Brimbank there. I had the pleasure of having lunch with him and I said, mate, have we got a deal for you? Because we're going to Brimbank and we're starting in Brimbank in about a month or so. So that's going to be extremely exciting. So I'll conclude there. I've tried to make something that's very complex, easy to digest, and I'd welcome any questions.
Thank you very much. Thank you, that was fantastic. Any questions? Yes? You might need the microphone. People behind you can't hear, I think.
G'day Rob. Did Geelong install a lot of gym type equipment in parklands, and if they did, how successful was it and what target group seems to use it?
Okay, I guess in one sense I can say that we didn't go in to suggest that, and that was not part of this program. I do know that they do have some gym equipment in the Barwon parklands. When I approached this, I didn't approach to measure any effect or use of those. I looked at bulk numbers of people who were coming in and how we were recruiting them through and how recurrent they came through, but not any changes in health and not any changes in, well, we knew what they were doing in the targeted programs, but not in the untargeted. You'd have to ask anyone from Geelong City Council about the use of those things. They're very, very hard to actually measure. Passive use, active use, group use, whether they're used by boot camps and things like that. So in long, your answer is no, I have no idea.
Yes? Right down here.
Thank you. I'm just wondering how important you think it is that this sort of catalytic change is driven by a health professional such as yourself, or could it just be an idea that's taken up and infected elsewhere without being driven by a health professional?
Yep. That's a great question. What we need is knowledge translators, and knowledge translators could come from any part. You obviously need passion, and you also need to understand the language. I speak a different language to you guys. When I say the word environment, environment to me is not just the trees, the birds, the bees and all those other things. To me, the environment is something that actually nurtures a human being. So, our concepts are different just even in that simple term. So when I say nurture a human being, that's love, food and air, water and green space is only one part of what I would say is a health part is an environment. So for you to be successful in this, you would need a communicator that understands language on both sectors. I'm forever being pulled up in the park sector for not understanding their language and for what they're talking about. So I need to be aware of actually how we do that to communicate across. So in short, I think it'll be tough without actually doing that. There are a lot of health visionaries out there like myself who can be tapped into, and you know, when moving a model somewhere else, that's what we're looking for. We're looking for the parks visionaries, we're looking for the local government visionaries, we're looking for the health visionaries that actually will say, yeah, I know this, I'll do it. So for instance, you know, Jason Trethowan from the Medicare local saying, I love this and I want to push this over the whole of Australia, is for me to say, I've got a health buy-in here. I don't have to actually do my work in Geelong anymore, he'll do it for me. And then, you know, the odd GP picks it up and takes it on, and then it snowballs. So the starting point is, yes, you will need a health translator.
Okay, thank you very much, Rob. And please, we run up, accept this gift from the organisers. Thank you very much indeed.